Hello, and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. It's being said that we're in the middle of the worst drug epidemic in U.S. history, fueled by individuals who are becoming addicted to prescription opioids. Millions of people are addicted. Tens of thousands are dying annually, according to statistics. Our guest in studio today is a licensed clinical social worker, certified biofeedback practitioner, a chronic pain survivor herself, the past president of the Northeast Regional Biofeedback Society, and the author of The Truth About Chronic Pain Treatments, the Best and Worst Strategies for Becoming Pain-Free. Our guest in studio today is Cindy Perlin. Welcome to Health Professional Radio today, Cindy.
Thank you.
Thank you. The worst drug epidemic in U.S. history. Now, we're talking specifically about opioids, or has it become, have opioids just surpassed all the other drugs put together to become its own epidemic?
Yes, that's the case, that opioids are just so widespread as a drug of abuse. They're in every region of the country, in every town and city, and they're causing severe problems everywhere.
Now, we're talking specifically about opioids. Now, these are prescription drugs. I mean, I know that they're being sold in many instances illegally on the streets and even sometimes illegally from healthcare facilities and pharmacies. But they are legal prescribed drugs. How are people becoming so addicted to these drugs?
Well, what happened is that when the drug manufacturers came up with these opioids, they promoted them as virtually addiction-free. They said that less than 0.01% of patients given them for chronic pain would become addicted. And that just wasn't the case. They actually were held criminally liable for fraud and fined over $600 million for telling physicians that, and basically causing this epidemic because physicians felt that they could prescribe these readily for just about any pain condition. And it takes about a week for a patient to become dependent on an opioid. Dependency means that if you stop taking them, you will have withdrawal, and withdrawal can be very, very unpleasant, and most people will want to avoid it, so they keep taking the opioids, and sometimes they seek more, and it's the beginning of addiction for many people.
Now, are we talking, you say it takes a week, it takes a week even if you're taking them as prescribed, or are we talking about it takes a week if you're abusing them?
It takes a week even if you're taking them as prescribed, because your body adapts to having them in the system and starts reducing its production of natural opioids. And the body also produces more adrenaline because the opioids are sedating and the body wants you to be awake. So you have excess adrenaline when you stop taking the opioids, and that causes some of the problems that people experience as withdrawal.
Okay. Now, you are an author. Are you a new author, or is this one of several books that you've written, The Truth About Chronic Pain Treatments, the Best and Worst Strategies for Becoming Pain-Free?
This is my first book.
Congratulations.
Thank you.
Why did you write this book? How did you become interested in chronic pain, the treatments, and specifically the problem with these opioids?
Well, when I was 25 years old, which was 38 years ago, I developed a severe back pain problem. And it just got worse and worse until I was completely disabled and in agony 24/7. And I went to lots of doctors, and they gave me lots of drugs, and nothing helped. And I was in pretty bad shape for about 3.5 years until I stumbled upon a book about the mind-body relationship in pain. And I used some of the things in the book to guide me in getting well. And when I look back on that now and all the things that I did to heal, and I see what's happening with prescription opioids, I realize that so many patients are still in the dark about how to deal with pain, and they're being severely harmed by the medical profession when they're given these opioids. So I'm pretty passionate about this subject, and that's why I wrote the book, to guide patients and healthcare professionals in how to treat pain safely and effectively.
I understand that President Barack Obama has proposed a $1 billion initiative to address this opioid problem that includes funding for prescription drug monitoring programs and also expanding drug treatment. We're talking about the treatment of people that are addicted. Does that include weaning people, if that's the case, and allowing them to, maybe take less? Or are you talking about getting rid of opioids altogether? What is President Barack Obama's proposal going to do? And is $1 billion even enough? I mean, we're talking in terms of trillions these days when we're talking about things having to do with government funds.
Right. I don't think it's going to be anywhere enough. And part of the problem is it's not going to stem the tide of new addicts. Because it does nothing to redirect physicians away from prescribing too many drugs and towards appropriate pain treatments. So what the prescription drug monitoring programs do is they keep a record of every patient who gets a prescription and every doctor who writes them, so that if a doctor is considering writing a prescription for a patient, he or she could check to see if that patient has been doctor shopping and getting other prescriptions from other places. And also it allows the powers that be to monitor the doctors and see how many prescriptions they're writing and see if they're pill mills or if, in the opinion of the authorities, they're writing too many prescriptions. What's happening with this that's pretty terrible is two things. Some doctors are cutting patients off abruptly who've been on these drugs for many years to deal with their pain and leaving their patients with nothing and no alternative except to seek opioids on the street, because withdrawal is so unpleasant if you've become very dependent on these drugs that you'll do anything to stop it. And what people are doing is they're turning to heroin. And the heroin abuse problem has been escalating in addition to the prescription abuse problem. So if you wait till people are addicted and then you give them drug treatment, you're really getting at the problem much too late. And then opioid addiction is notoriously difficult to treat because the brain has changed and the brain is craving these drugs. So most of the drug treatment proposals are to use other drugs to replace prescription opioids. So you're still giving people medication to treat the problem.
You're the author of The Truth About Chronic Pain Treatments, The Best and Worst Strategies for Becoming Pain-Free. Obviously, your book covers some alternative strategies, herbal interventions, things of that nature. Where can our listeners get a copy of your book? Is it available at your website in addition to Barnes & Noble, Amazon, and most of the booksellers out there? Your website, CindyPerlin.com.
Right. I don't sell the book directly from my website, but there is a link from the website to purchase the book on Amazon, and it's also at barnesandnoble.com. It's available in an ebook as well as a print book, and it can also be ordered through your local bookstore.
And I understand that there's some incentive for folks to visit you and check out your online presence, especially now. Is that correct?
Right. If you go to my website, you will see either a pop-up that allows you to sign up for my newsletter and get a free download. And the download is the 5 best self-help strategies for healing chronic pain. And if you don't get a pop-up, you can scroll down to the bottom of the screen, and there's a place to sign up. And it's a very useful handout for physicians to give patients or for patients in pain to use themselves. Has a lot of inexpensive strategies and tools that people can use to relieve their pain.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio with Cindy Perlin, licensed clinical social worker, certified biofeedback practitioner, chronic pain survivor, past president of the Northeast Regional Biofeedback Society, and the author of The Truth About Chronic Pain Treatments, the best and worst strategies for becoming pain-free. We've been in studio this afternoon talking about some of the strategies that she offers in her book, some of the incentives to be found at her website, cindyperlin.com, and also a bit about President Barack Obama's proposal to pump $1.1 billion into fighting this opioid epidemic. It's been great having you here with us today, Cindy.
Thank you.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.